been done is half understood by the students today. It will take even ages to understand the contribution this human mind has given to homeopathy. And definitely I would say the contribution what our sir has given to homeopathy is remarkable and outstanding contributions he has made, and nothing I could say no one could have done this job so well, so organized, so mathematical. And I'm very happy when students tell me, yes, this is homeopathy, what we have desired of, what we have dreamed of, and I am making his dream come true through teaching you that yes, body and mind are nothing but a calculative mechanism. It's just like mathematics, nothing goes untouched from your eyes, or if you don't have that perception, it is not in their mind, you will not be able to see it in the patient. So for all those factors, you have to have everything well understood, well studied, so that you get the deepest knowledge of homeopathy and the case. So today again, since we are there on the psychosis part, I would like to tell one thing very important is here, that as we all know that everything like the whole body is an organization of colony of trillion of cells, and each cell has derived in itself from a stem cell, or a cell which had the immense capacity to divide and function into multiple things. They are the stem cells. So as per the need being generated, the whole constitution was being developed. So we have already seen that sora is nothing but the basic need, the basic desire, whereas psychosis is nothing but the whole generation, the constructive defense, and the mitotic process which is taking place just as an adaptation to whatever construction. It is a constructive defense, I should say, and to compensate, it has to be a compensatory mechanism to overpower or to balance the need of that individual, so that the whole function is secured and the patient can have a better life. So syphilis is definitely a destructive pathophysiology. So going ahead to today's case, I'm bringing up one more point is just a reminder to you all ki that how psychosis flares up through sora is through the insecurities, fear, and all those feelings which we have, which we are not able to overcome. So this is the basic need, the physiological need, that is we need food, water, and sleep, which is the most essential thing of the life. लाके दे देना पड़ेगा. And the next need of the life was safety and belongingness. But you should also know that the whole evolutionary science has developed over a period of time, and this was what was required by the body. And as we started evolving, the generation started growing, as we have already seen in the last lecture ki how evolution has taken place, and how our needs have developed. So, today we are going to deal with a case of asthma. This is a case of a male patient, 35 years old male, who had come to us with asthma, and he complained that since 8 years, that is since 8 years he's been complaining of chronic cough. There is dyspnea with wheezing sound, and he needs to take inhalers, and all those complaints are aggravated in the morning hours through exertion in rainy weather, dusty weather. Any change of slightest change of weather will lead to an aggravation. So all complaints start with nose blocked on and off, with running nose sometimes. Along with it, there is anxiety, body pain, chest pain, and there is a sensation of being tired, tied around something suffocative feeling, and there is a whistling sound which is there, and he cannot walk or run faster because of the breathlessness he has. The other complaints is alopecia, that is in patch, hair fall is there, and atopic dermatitis. This alopecia is androgynoid baldness what he has, which is very common in male group, and everyone in his family also has got this kind of baldness. Then the second complaint he came up was, there is severe itching, eruptions which are there on the soles and at the lumbar region. But this dermatitis, what is being called by doctors, probably it was somewhere like tinea, like eruptions, but right now they were not there when he came to us because he has already applied lot of ointments upon it. Now he also has complaints of his hemorrhoids, that is bleeding, PR, that something is coming out and he has to manually reduce that mass, but it is actually retractable. And since he had already taken lot of steroids in his young age just to increase the weight, and overuse of allopathic drug was there, because of which the complaints had started. And actually when the complaints had started, there was so severe bleeding, PR, that he really got scared because of that bleeding. And he blames that because of all those things my complaints have started. And he could correlate ki, I in the history he had said ki all the complaints had started after taking all those abuse of drugs which was there. And he said ki this was my biggest mistake of life. And during the complaints he comes to me every he would come very often to us. During the lockdown time he has started giving a case, and he used to come to us for 3 years for his daughter and for his wife, but for his complaints he has recently visited us. So during the asthmatic phase he says कि मैम बहुत ज़्यादा breathlessness होता है, और frequent asthmatic attacks आ रहे हैं, and the need of nebulizer or the need of inhaler is very high. He would take more than 10 to 12 puffs at a time. Even after the medicine he said ki the puff intensity has not reduced. This is what I'm telling you after giving the first medicine. And yes, I would like to tell you that once I gave the first medicine, I was really biased with the case and I gave a wrong medicine. After that he does not have back pain, which he had not reported to us, but after giving the medicine, the rashes had increased over the thigh, but still lumbar pain had started. So this was what wrong prescription has acted upon him. This is a failure, I say, because in the initial part, because he started to me in March and till uh, October, I was really sailing in a wrong boat. I was not able to understand the whole case completely, and I was stuck up somewhere with my own biases. You have to accept your faults so that you can rectify them in future, and that will really be beneficial to you all too. This is what I have learned from sir. If you don't grow from your mistakes, then you will never grow in your life. So accept whatever faults you have done, accept your mistakes which has been done by you, and then see how you grow ahead and move towards your dream path. So this was the case which was half understood by me. Somewhere I think I got hurried to solve this case, or pressure of time must have been there, because this was March period and I remember this was again a COVID time. So this patient came to me because he had fear that he should not suffer COVID, and just for a preventive part, it is not good that I have a respiratory ill disease, and COVID is really fatal for those who are suffering from COVID. So this is a really eye opener for me. And when I was going through the Materia Medica part, I could see that the beauty of Materia Medica, the beauty of homeopathy was being taught to me through this case also. And how if we give a partial simillimum, the patient it is your destiny that patient is still there with you, but definitely you don't get good results. And somewhere the patient is lingering around your whole clinic and coming to you constantly complaining, but that hope the patient carries to you. This patient used to come to me every week with the hope that, yes ma'am, since you have cured my daughter, you have cured my wife, I'm very sure you will be able to cure me too, and I will be very sincere and honest to you in defining my disease, in giving my follow-ups. Only thing I want is just to get rid of this disease. So this is the immense faith the patient carries. So this was the whole scenario I have described. So definitely, since the disease is at the level of asthma, and this is a respiratory disorder along with baldness and hemorrhoids, but a partial familimum gives a blunder to this case. I have not written and documented the whole follow-ups because it was something I could have discussed orally. I will do it for you all. So, what mistakes I have done, I would like to tell you. So, this was the case of asthma. So, let us go ahead with the understanding of the disease. So, anyone who would like to share, what do you understand by asthma? What do you all understand by asthma? So again, the pattern is same, understanding the disease on the aspect of mind. But first, let us understand what the body is trying to say. So, what do you understand? What does the body say over here? Yes, asthma is bronchoconstriction. Definitely. Go ahead. So, what do you mean by bronchoconstriction? So, what is the tissue which is being involved over here in asthma? Is it the alveolar tissue of the lungs? What is the,
The lungs.
yeah,
Bronchi of the lungs.
yeah, it is bronchioles, bronchi of the lungs. What is the layer? Now you all are really expert. Last time you had an active participation, so I expect a lot of you, or a lot of things from you all now, and I don't expect it is two-way process. So it is an endodermal disease, endodermal tissue layer second. Okay, is a condition where patient airway inflamed, narrow, and produce extra mucus, so difficulty in breathing. Perfect. So we all know, yes, it is a bronchial inflammation. So how does this inflammation is triggered, or how does this inflammation starts on? You are correct with the tissue. It is very clear. This is a very common disease which we are seeing. And what is the pathophysiology of asthma? If we all know, yeah, it's bronchial inflammation, but how does that whole cascade of inflammation at the bronchial level takes place? It is, yes, narrowing of mucus collection is there. Difficulty in breathing is there because of that constriction.
So basically, it is airflow obstruction due to hyper responsiveness of the bronchioles, like some allergy or some response.
Fine. Is it always a hypersensitive response? Yes, definitely it is a hyper responsive or a hypersensitive airway, but it is not a hypersensitive airway disease, which is completely an atopic asthmatic disorder. But we are talking about simple. Here, you did not see in this case was many factors which he was allergic to. He did not give you long list of the complaints being aggravated. Yes, it was being aggravated by dust, rainy weather, change of weather, right? But there is no huge list of any food particles or any other particles which he must be sensitive about. Definitely it is a hypersensitive reaction, just like urticaria. What we have seen, urticaria is at the level of blood vessels. This is a hypersensitive response at the level of the bronchioles. And whole cascade starts with IgE, that is immunoglobulin E secreting mast cells. So let us go ahead. Definitely you all are very clear with the pathophysiology, with the basics of asthma, so it will be very easy for me to explain the things today, since it is a very common disease. So going ahead with today's pathology, understanding the seat of disease. So, asthma is nothing but a long term inflammatory disease of the airway. It is characterized by airflow obstruction and easily triggered bronchospasm. Symptoms include there has to be wheezing, coughing, chest tightness, and shortness of breath. If wheezing is not predominantly there, it is only coughing, then you won't label it as bronchitis, or you will label it only bronchitis. Wheezing is the key word for asthma, and they are frequent episodes which take place. So when we are taking the respiratory system, evolutionary wise, again I really love taking into consideration the evolution part. I really love correlating things to the evolution and embryologically, because that really helps in understanding the cases, solving the whole mystery of the case at the disease level. And if you're clinically very sound, this is my experience, that if you're clinically very sound, you will really get good results. At least you will not do blunders clinically, and that will be really an appreciation, or a cherry to the top of cake, what we say. That if you have a good clinical and a sound knowledge, you will definitely practice very well. If you see our masters like Bonning Hussein, Boger, and they were really good with the pathological prescriptions. If you see Murphy, they Clark, Farrington, they were outstandingly good in their clinical knowledge and diagnostic part. So those people who say that diagnosis से क्या फर्क पड़ता है, we depend upon the PQRS, I will tell that no, diagnosis is something which has to be done before you enter into certain case. Because if a case is well diagnosed, you will know the seat of disease, the pathology, the miasmatic understanding, the evolution, and the whole pathophysiology of the disease will tell you at what stage the patient is to you, and what actions have to be taken. And the miasms are really decided upon the pathophysiology of the disease. So how the disease has come up, how the tissue has evolved, will definitely help you in understanding the emotional pathology also. So here, when we see the respiratory system was there since the evolutionary time. That was the first system which has developed into the system, because this is the most essential part of the aerobic respiration, where we say, where the respiration process has really started. I would say when the life started on this earth, actually the respiration must have begun. And since we have evolved from the water cycle, we have evolved somewhere from the water kingdom. So definitely the evolution proves you that the whole system has actually evolved, and that evolution can be seen even in the respiratory system. You know that what advanced respiratory system what we have, the whole huge bronchovascular tree what we have is the most advanced system of respiration what we have in our system. And really the amphibians, then the vertebrates they developed, and how they have evolved. Initially when we talk about the animals like the fishes, they did not have a proper system, but they had gills, and those gills are nothing but at the primordial level they had developed into the pharyngeal arches. And we all know that the whole embryo, when at a very early stage of the development, is really difficult to be differentiated from a tadpole or from an early and what I should say, it was a very early primordial development. So this whole respiratory system has developed from that pharyngeal arch, and a diverticulum which has developed from the pharyngeal arch. So definitely the pharynx which was there, or the gills which were there in the fishes, they had developed gradually, they took the shape. And one more thing I would like to tell you is the whole body is a miracle machine, and nothing goes unnoticed, is and nothing in your body is without any use. If you tell me that this hair, so I will tell you yes, it has got a certain function, it has got a certain system of development. Similarly, if you talk about the respiratory system, since the life was in the premature ages, it was in the water. First it was in the water, so definitely the exchange of gases, everything was dependent upon the water itself. So fishes had a different respiratory system, and they had an exchange of gases which would take place from their gills, and their gills were nothing but development from that pharyngeal pouches. And gradually those pharyngeal pouches or those pharyngeal arch in human being then evolved and developed the tracheobronchial tree into an development. So you all know one more thing is कि developmentally if you see फर्स्ट नीड जो लगी बॉडी को सरवाइव करने के लिए वो ये है कि अगर मेरे को ग्रो करना है तो आई विल नीड सर्टेन सिस्टम्स which are most essential for my survival. And this is the most important system, because we if I ask you ki you can live without water, you will say yes, I can survive without water for 7 days. If I say you can survive without food, you will say yes, you can survive without food for even months, we have noticed. But if I say can you survive without air, you will say no, because for a second also we cannot survive without oxygen, we cannot survive without breathing. So breathing is the most essential aspect of our life, and this is where the breathing starts matlab life begins, and breathing ends matlab life ends. So this is somewhere a connection to your higher world, the connection between your outer world and the inner world. If I tell you कि I have to survive, so first you will say is अच्छा ठीक है सांसें चल रही है मतलब there is survival, जिंदगी है. So this is the life energy force which is running inside the whole system. So whenever the life must have evolved millions and trillions years back, as you know that it started from a god particle you say, or a big bang theory which says कि there was a huge collision which had occurred, and after that there were huge accumulation of gases, and then they got settled gradually, and where oxygen, hydrogen, carbon as molecules they came up, and then the whole evolution started and came into existence. But first need for survival on this earth was oxygen. So we needed is a mechanism which could actually exchange the energy. You must have heard of one group of people known as breatharians. if I don't know, you all know about it, but they are the people, they are the group of society of people who have the capacity to live without water and food for years together. There is a group of people, I knew some person who died in 2020. He was a breatharian, being living on this earth without food, without water, almost since more than 50, 60 years. He died at the age of 74 years, and he belonged to a community at Gujarat. I don't remember his name, but he was one of the breatharians. So they are the people who know how to exchange this extra energy, or the ATP generation can be done from the atmospheric oxygen. So they know how to exchange that. So this was the system which was there before. You see, and plants can also breathe. They also have their own capacity of breathing. They also exchange gases, and through exchange of gases they really utilize the whole system, and they develop their whole life cycle. So respiratory system is the most essential part, and therefore in your body the respiratory buds or the respiratory development is the most essential development which we need to understand. But we also need to understand that in the intranatal life, till the fetus is in the mother's womb, there is no active exchange of gases which has to take place, and therefore the lungs are not active in the intranatal life, but they get active when the life enters into the outer world. So definitely the respiratory system is the first need of the body. And as we are evolving, when we were in the water cycle, it is just similar like we are in the mother's womb, we are also surrounded by water. So we did not need that respiratory system at the alveolar level to exchange the gases, since we are getting oxygenated blood from our parent, from our motherhood. So this is what is the evolutionary part. And you also know this कि जैसे जैसे नीड बनती है वैसे वैसे give an example to you, like the function is going to decide what structure is going to develop in the whole system. I will tell you, you tell me any tissue, any part of the body, and I'll tell you everything is dependent upon the function. What is the need of that individual, what is the need of that structure, and according to the need the planning will take place. So when we were in the water, the need was just to exchange the gases at the water level, and that could be done from a simplest mechanism. But when the need came up that yes, this water is not sufficient for me to survive, now I need more oxygen to be taken place, and that small gills are not sufficient for my survival. And since I have to leave this land and go into the territory, leave the water and go into the territory of the land, and I need to have certain system and an advanced mechanism of breathing so that I can survive. I'll give you a simplest example. Ki you have gone to an architect and you say that I have a land of 2000 square feet, and I want to build certain things, I want a construction to be done, and I've come to you. So the first thing architect will ask you, okay, what is your plan? What do you see as a vision over here? What you want to construct? So this is the first question he will ask you. So that question of what you want to construct is nothing but the answer to your need, that what you need is nothing but your desire, what you want to have, what is your planning. So first you will have a pilot planning, that yes, after 10 years or after 2 years I want to see that this place is being flourished well, it has got n number of patients coming to you. So the architect will say, oh, now I understand that you need to build a hospital. Or I say, no, I want that my kids or my whole family, my parents should be there with me, and I want to build a beautiful home, a well luxurious palace what I have planned for. So definitely I need a home. So that will be a residential place. Someone would say, no, I need a corporate hospital to be built up or a corporate office to be built up. So the need is a business sector. Someone wants a showroom. So definitely the architect will make the first planning according to the need. If you need a home, a residence, the shape will be decided according to the home. If you need a hospital, the shape will be planned according to the need for a hospital. If you think that you need a residential place with full, sorry, a corporate office, you will need cubicles, you will need different places where your whole staff can sit with you. You need the whole structuralization according to it. Similarly, we are a miracle machine and we cannot be made without any purpose. Everything on this earth, on this universe, has got a purpose. Similarly, the whole body structure has developed according to the purpose of life, and that is what function you have to play. So if you are going to be in future a bodybuilder, you will have a robust body. If you want to become a model, you will have to take care of your delicate skin, you have to take care of your beauty, you will be more beauty conscious, more look conscious in so that you can groom yourself and you are presentable to the world. If you want to be a person of a management part, so you will have that domination qualities, you need to develop all those qualities within you. Similarly, the whole system develops. So the whole system develops according to the function. So the structure is decided according to what function you need to play. Similarly, the need for me, for us as human beings in the ancestral part was like what we have seen as vertebrates. The need was that we had to shift to the land. We had to live a life where we had to grow up and search our food over the land. So when life came from the water to the earth or to the land, the need arise that now there is no water here, so I need to exchange the gases directly from the atmosphere. But if I take the whole atmospheric air just like a I engulf like this, I will really not be able to exchange the whole gases. But my system needs a proper mechanism. If I have to live in an environment where there is cold, there is hot, I'm exposed to rains equally, I'm exposed to extreme humid temperature, I'm extreme cold has to be there. So if you see like polar bear and all, you will see that their respiratory system is so active that they can actually increase their body BMR through the breathing. And since it is a chilling cold over there, and actually the breathing, the breath we take, the vapors are really very essential for us. So the whole system developed like this. And those people who are living in deserts, like you see a camel, so camel had got a thick bushy mucosa over the nose. They have got thick hair so that they can filter the sand which is just entering their body. So you know that the whole system has developed according to the function, according to the need of survival. And the main motive is that the better you adapt, the better you will survive. And the whole adaptive mechanism is still continuing, and this is never going to stop. If you see the evolution 20 years back, 30 years back, 50 years back, or a century back, if you see the people like if you see the warriors, if you see the life era of 500 years back, when there used to be so many wars, the whole culture was of Raja Shahi. The whole culture was that they were made to dominate. They wanted, the desire was to rule the earth. So see the build they had. See Shivaji. If you see Shivaji, you see Sambhaji, you see those warriors who were there in those era, even Jhansi or Rani Lakshmi Bai, you see their build, the robust they were, because physically their body used to be very hard, tough as iron, because the need at that time was more of physical capacity, more of physical strength, more of physical work. So today, if you see the sword of Shivaji, which is being kept in the just see the height at what the palaces were built, and today the technology cannot build such beautiful palaces at such a huge height. See the strength, the power they must have had in those time period. And today we are just slave to these technologies have advanced, but we have become physically very weak. If you talk about us, our nani and dadis are able to work more better, because but mentally we are more occupied. We are teaching our kids that mentally you have to be very active, and our frontal cortex is developing, our cerebral cortex is developing, but physical strength is reducing because we are not taking use of the whole body as such in totality. So this is the need versus demand. So when we needed that, we need a proper system. I cannot just take air which is very poisonous outside. The in air, since it is a combination of oxygen, methane, nitrogen, I need a system which can filter such gases which is poisonous to my whole system. I need a system because I have to live even in a cold space, I have to live even in a warm space, and my core temperature of the body has to be maintained. So I need a system which can filter the whole gases which is passing through my respiratory system. I need a system which can actually calm down the temperature or maintain the temperature which is entering into my respiratory system, because my whole body internally is really a delicate darling, and I cannot afford injuring my tissues and the cells. So definitely the whole system, the whole pathology or the whole structure has developed like that. In order to develop this beautiful mechanism, in order to develop the beautiful structure, each and every tissue which is present has got its own function, which is being played, and according to the need the tissues are being divided. If you see from the nose till the lungs, if I teach you the whole respiratory system, it is a very vast topic, but let's constrict ourselves to the bronchioles, because we are at the level of bronchial asthma. But still a rough, I'll tell you that since the air is passing through the nose, so we have a particular system. You can read the anatomy of nose, you will understand how the nose has developed. When it goes to the throat, and from the trachea, from the larynx, when the air enters to the trachea, and it has to get divided into the lungs. Here also the whole system is like a tree with multiple branches being divided here and there. And the whole lung, which is a very spongy organ and tissue, if you see that it has to exchange gases continuously. A lung cannot stop for a moment, it cannot stop, it functions from the moment you are born up to the death. It is continuously in harmoniously working along with the heart. So the control system of your lungs is not given to you, it is to the central part or the hindbrain, because it has developed from the primitive organs or the primitive lifetime, and therefore the mesodermal sorry endodermal organs are in the control of the uh, medulla oblongata, what you say, or your brain stem, because that brain stem is nothing but the part of your old brain. So this is the whole evolution which has come up, and this is not under your control, friends. And if it is under your control, you would have spoiled it. Like you have, you this is something which nature has not gifted you, because the life and death is not under your control. So definitely when we are talking about your respiratory system, we are talking about your life, we are talking about the breath we are taking. That is the basic need for survival, and the whole system has developed that way. So we developed from the amphibians, from the reptiles, or from the water element, where the pharyngeal arches had divided himself. And when the pharyngeal arches divided, a tracheo-esophageal sphincter was developed, which divided, and trachea and esophagus was born. And then the trachea divides inside, and goes like this from upper part to the lower part, goes down 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 down, and then it starts branching itself, divides into two main branches, then it again goes into branching further, just like a tree root, I should say. So this is the whole development which takes place, and this is very essential because this is the conducting system of the lungs. The way, since the endodermal, they are the lining tissues of the endoderm, they are not involved in the exchange of gases, but they are just having the function of conducting. I already told you, if I take the breathing air directly inside me, I have multiple organisms which are present there, microorganisms which are there, dust particles which are there. The temperature of this air which I'm breathing is not normal and not optimal, and it can harm to my lungs also. So therefore I needed a system which acted as a conducting system of the airway, or the airway, I should say, and the function was just to trap if anything which was hazardous, to trap anything which was really something which was dangerous. And since it is entering into the most important organ, from least important to the most important organ, there has to be filters which are being made by the body. So this is how the beautiful respiratory system had evolved. If you see, I'll tell you, if you see the histopathologically also, you will see that many tissues are there, and each tissue has its own function. If you talk about trachea, till trachea, you have got the C-shaped cartilage, and this C-shaped cartilage gives you that protection. So every, why that protection is there? Because you cannot have a stiff neck over here. You cannot have a hard bony tissue which will just inhibit your movement. So you needed something which is slightly flexible, and just because just backside of the trachea you have got an esophagus. So this is really a complex system. Don't go into confusion, but understand the beauty why this structure has developed in this way. So if I transfer the air directly into my lungs, that will really be dangerous. So I have first line of defenses at my gateway of respiratory system. They are nothing but the tonsils, your whole lymphatic system, the lymphoid tissue, or the ring. What we have over here, having lots of adenoids, we have a lot of lymphatic tissue filled with T cell, B cell, having your primary defense. So the first, if any, first the fine particles, if they are there, they are being trapped into your nose, then they enter into your pharynx, and in the pharynx they are being trapped by the immune mechanism what you have. And still, if the air enters inside, this whole system is so beautiful that it will trap into the fimbrias and the mucus what we secrete. They will trap the gross pathological particles which are prevented to enter your lungs. And then if the air enters inside, the alveolus are free. Now my function is only to exchange the gases. That is the primary function. So the whole structure is developed in such way. And if you know that this system has got a conduction, more important is conduction, then it will not have lot of secretions. You have dryness over here, this will give you a dry cough. So tracheitis will give you a dry hacking cough. And since this trachea is nothing like a C-shaped cartilage, just like a drum, therefore when trachea is getting affected, you get large, loud, uh, barking type of cough, or drum like cough, because it is just a conducting zone of your respiratory system. But once the lower respiratory part is getting affected, that is from the bronchus. The bronchus has got a beautiful system of of the whole development. I will tell you later. I would just like to tell you one more thing developmentally is that this whole tree develops from above downwards, and therefore embryologically this whole development is from above downward and out to inner side. It is just like something, a tree is growing and the roots are developing inside, and the whole uh, interstitium of the lung is nothing but of the mesoderm origin, but the whole bronchial and the trachea is of the endodermal origin. So this is the endoderm, and therefore when you talk about Hering's law in these cases, when you talk about Hering's law, the disease has to be from inside out. So this is not above downward but inside out. So because the development has taken place inside out, the bronchial tube has developed in this manner, so therefore the disease, when you are taking the Hering's law, it will go into opposite direction. That is the way the disease has come in, the disease has to be thrown out in the other way. So since it is developing from above downward and inside, then the outside. So Hering's law will be also observed that first the disease, if you have a patient coming to you with coryza, then dry cough, and then with a hacking cough, the first symptom which has to be settled down is that hacking cough with expectoration which is there, with dyspnea, has to settle first. Then this cough will come up, and then coryza should start. So this is where the Hering's law will come up in respiratory diseases, because I have seen many people committing this mistake कि मैम मेडिसिन दिया, कोराइजा तो ठीक हो गया, बट उसके बाद से डिस्निया बढ़ गया पेशेंट का. सो दिस इज अ रॉन्ग डायरेक्शन, because developmentally the disease has not developed like this. So this is embryological development importance. And since this has developed from the endoderm, the mucosal lining, the epithelial cells of the alveoli, they are endodermal origin, whereas the muscles and cartilage and the visceral pleura is of the mesodermal origin. And you all know that the whole development starts from the third week. The whole system, the bud is there before the 3 weeks, but the whole system develops even till the birth, but the activation takes place after the birth. But the surfactant which is required starts developing during the 8th month, that is after 28 weeks. So this is the whole respiratory system, how it evolved, how it is needed. You also know one more thing I will add over here. Yes, this is what I wanted to show is this is the trachea. So this will give you a dry hacking cough. The mucosal lining in the trachea is different from the mucosal lining in the bronchioles. Uh, so first the trachea divides into the primary bronchus, then the secondary, that is the second division, then you have multiple divisions at taking place going to the tertiary or the segmental or lobar bronchi, what we say. Primarily when you talk about bronchial asthma, so the disease is not affecting the interstitium of the lung, but it is affecting the bronchial tree or the bronchi or the tree. And therefore when you breathe in through a tube or a pipe, you have that whistling sound which is coming up. And when it is disease part, the spasm part, you have got a narrowed airway, and because of which the wheeze is there. So in any disease, if you see that there is a wheeze, then 100% it is the bronchioles which are getting affected.